The response is divided amongst different parts by different partners. The Ministry of Health and Wellness and the government of Jamaica are leading this response. They're leading it with public health inspectors. They're leading it with nurses and doctors. They're leading it with the range of community health needs. They are taking charge and doing their best in a very challenging environment to be the front line of the response to dealing with triage of critical patients, of dealing with women that are still have to deliver their child in a very difficult situation. They are the ones that are dealing with injuries that as a result of people wandering around destroyed areas, nails in feet, head injuries. They are the front lines of providing the services. Partners, we have tremendous collaboration from the UN family, UNICEF, World Food Program, really at the lead of providing the logistics, the World Food Program providing leadership on logistics, UNICEF providing the care and support to the hundreds of thousands of children that have been identified that are at immediate risk right now. There are other partners that are leaning in also in the UN family, UNFPA, really leaning into this issue of supporting the hygiene kits for families and women, really important pieces in a very difficult situation. Additionally, you have a lot of NGOs that are also leaning into this. We are in collaboration with Samaritan Purse in the United States. They are mobilizing their team to provide immediate care. We know that the government of Spain is leaning in also on immediate care, mobilizing an emergency medical team. We're discussing with the military in Canada, the military in the United States, the military with the Netherlands, all leaning into these things. So civil society, as well as international organizations and governments, are all leaning into this piece. Then, of course, we have to talk about PAHO. We have a particular role. And really, the most important role is to respond to the request the Ministry of Health is guiding us to respond to. Their primary concern, or their primary ask from PAHO, one, we need coordination and leadership on psychosocial support, mental health. That is the top of the list. The second thing PAHO is leaning into is in this area of immediate response to try to replace these destroyed health systems. We are coordinating the emergency medical teams together with the Ministry of Health and Wellness, them leading and us responding. The last piece that we are paying particular attention to is around water and sanitation in health facilities. No water, no sanitation. We have a big problem with health. But this is a big ask amongst all the different pieces. The Ministry of Health, civil society, international organizations and governments, and the Pan American Health Organization and the World Health Organization responding hand in hand. But let's not kid ourselves. It's an exceptionally challenging situation. The coordination function, making sure that we have all partners together saying, we understand what's taking place between the different sectors. That is the most difficult part that we have, because there's a lot of generosity. A lot of people want to help. A lot of people want to lean in, but we need to do this as best as we can on the coordination piece. PAHO is also leading that work in leading the health cluster, an exceptionally complicated space.